Hello, and welcome to today's presentation on Allscripts, the clear leader in software, services, information, and connectivity solutions that empower physicians and other healthcare providers to deliver best-in-class patient safety, clinical outcomes, and financial results. Today, we will be discussing a strategic plan for Allscripts to gain a large market share in the electronic health records. A 5 forces analysis was performed to evaluate Allscripts. This analysis is set up to explain the varying rates of profitability among competing industries. The same 5 forces affect all industries. Competition between current players is the first force we analyzed. Currently, Allscripts operates 4 business units that provide automated clinical business solutions. These include Professional Solutions, Enterprise Solutions, Health Systems Group, and Medication Services. Allscripts has a focused target group of small physicians working outside of hospitals, is the leading e-prescribing vendor, and has established a client base of 150,000 physicians, 700 hospitals, and 7,000 post-acute facilities. Their competition consists of McKesson, Kaiser Permanente, and Microsoft. The next force is the threat of new entrants into the market. This field is left open for new entrants because of the lack of regulation and the peak in interest. Next, we looked at the threat of substitute products or services. Because the market is so open, Allscripts has an advantage because of their already built-in client list. They have also decided to focus on a single niche of the market, therefore lessening the threat of competitors. The fourth force is the bargaining power of customers. Customers have many options to choose from when selecting an EHR company, but few are going to choose a brand that has not already been proven effective. Fortunately, Allscripts has this proof in its already established client base. And finally, the last force to examine is the bargaining power of suppliers. Allscripts has similarly proven themselves as a stable, innovative, and effective company, and suppliers trust that Allscripts products will be effective. In theory, the combined strength of the 5 forces will determine whether an industry as a whole is profitable. We will now discuss a 4 corners analysis. This includes drivers, assumptions, current strategies, and capabilities. Allscripts is one of the top innovators in electronic medical record development and implementation in the U.S. Our mission is to be the leader in creative, innovative software, connectivity pathways, and information solutions that empower physicians and healthcare providers to improve health of both their patients and their bottom line. At Allscripts, our mantra is simple. We feel that now is the time to improve quality, to eliminate errors, and to reduce the cost of our disconnected healthcare system through an integrated communication network. We seek to expand upon our existing market share to create the Microsoft Office for healthcare. Our bottom line, we are a company that with a portfolio of solutions that can build one interconnected healthcare system and help deliver better outcomes for patients and better results for your organization. Allscripts management holds several key assumptions about the market for electronic healthcare records that form the foundation for which their current business strategy is built. Allscripts strongly believes that in the near term, EHR market will become substantially grown from federal HIT funding, including the American Recovery and Reinvestment Act of 2009. Allscripts CEO Glenn Tolman has publicly expressed an expectation that the ARRA funding will provide a substantial boost to each of the company's services. Allscripts management also holds the strong belief in the quality of their products. This is evident in several Allscripts strategies in which the company provides certain basic HIT products for free, with the expectation that providers who receive these free products will buy other Allscripts products in the future. Allscripts' current strategies for growth in the EHR market revolve around a central goal of gaining as much ARRA HIT funding as possible. One program, NEPSI, the National E-Prescribing Initiative, provides free electronic prescribing software to U.S. doctors. Allscripts plans to spend alone $3 million on NEPSI over a 5-year span. Allscripts is also aiming to capitalize on the opportunity presented by their recent merger with fellow HIT company Missy's. They plan to offer basic interfaces between Allscripts and Missy's products free of charge to the 90,000 former clients of Missy's practice management. Finally, Allscripts is attempting to position the organization to capitalize on the significant opportunity presented by the substantial number of small to mid-sized group practices who have yet to implement EHRs. Under the leadership of Glenn Tolman, Allscripts has positioned itself to take full advantage of the future growth of the health and information technology sector by focusing on its core business product, electronic records and e-prescribing. Allscripts merged with Missy's Healthcare in 2007 and currently has partnerships with 21 technology and healthcare industry leaders, such as General Electric, 3M, Cisco, Dell, HP, IBM, Intel, and Microsoft. As a result of the merger with Missy's, Allscripts now achieves greater economies of scale as a result, which is expected to realize $20 million in cost savings annually. The merger has also greatly increased the physician network, which has positive implications for Allscripts' EHR growth. As a result of January 2009, the Center for Medicaid and Medicare Services approved an e-prescribing incentive program, which provides physicians with a bonus of up to 2% Medicare billing, up to 5% each year for electronic prescribing. Since 2003, Allscripts has seen an average rate of growth at 37.5% over this period. This trend will likely grow in years to come as we continue to provide innovative solutions that connect doctors to patients. Allscripts has received a number of awards, such as an accreditation by the Certification Commission for Healthcare Information Technology, Class Highest Overall Perception Rating, Healthcare Informatics Top 100 Companies, and the Malcolm Baldrige Quality Award presented from the United States President, to name a few. Some of our weaknesses include the fact that we have not developed a personal electronic health records applications in the consumer market. Yet, our alliances with partner organizations may fill the gap if PHRs do become more widely used throughout the industry. Another weakness lies in the fact that we have not acquired many large hospital or health systems initially as clients. Such large facilities are likely to continue using one EHR system through the hospital unless tangible benefits are linked to our operating systems over one of the other companies. In the future, Allscripts is looking forward to robust growth in the expansion of the EHR market. We plan on capitalizing on the stimulus funding created by the government by highlighting how we as an organization follow the guidelines of meaningful use of EHR set out by our regulators. Allscripts plans to continue dominating the e-prescribing industry by expanding our participation in the NEPSI program. As providers become comfortable and satisfied with Allscripts e-prescribing software, they will become more likely to choose Allscripts for their future EHR needs. We will further our efforts to increase market share in the non-hospital market by providing discounts to our basic products to former Missy's clients in addition to free interfaces we already offer. Physicians drive much of the decision-making process in healthcare. With this in mind, we foster loyal physician networks to lobby hospitals for their preferences of using Allscripts over other systems. We believe this strategy cannot fail in achieving market success. In the light of recent changes from the scenario, Allscripts' overall strategy will need to interface with Google's personal health record software to ensure that interoperability is achieved. With the rapid expansion of Patients Like Me algorithm, EHRs will continue to be integral to the data collection of a rapidly changing population that the algorithm relies on. For this reason, EHRs will continue to be essential in healthcare facilities. In addition, the large e-prescribing component of Allscripts will still remain necessary because although patients can access information on which drugs work best for them, they still must go to a physician to receive prescriptions. In 2009, nearly 60% of doctors working outside the hospital who use EHRs use Allscripts products. At that time, roughly 450,000 doctors working outside of the hospital did not have access to EHRs. The launching of our future strategies aiming to expand our participation in the NEPSI program will allow us to capture a significant portion of this available market share. Our discount programs with former Missy's customers could alone potentially add up to 110,000 new clients. At the same time, NEPSI, originally growing at a rate of nearly 30,000 new physicians, has the potential to add tens of thousands of new clients to our professional solutions group. Considering our substantial pre-existing market share and the likelihood that our program expands, we expect to be comfortably positioned in the leading EHR provider in the non-hospital market. With such a substantial number of physicians using our product, Google's Patient Like Me, PHR, they would have a vested interest in accessing our EHRs, putting in a strong position to collaborate with Google. Thank you for listening to today's presentation on Allscripts.